Mr. Chairman, the last Congress made significant advancements, as we know, in lowering the cost of prescription drugs for seniors. And thanks in large part to the Inflation Reduction Act, which a number of us supported. The achievements of the IRA have been thoroughly discussed today and before today, and they'll be discussed again after today. And for right now, I think they bear repeating. Thanks to the work of this committee on this landmark legislation, seniors will receive recommended vaccinations for diseases like shingles, like the flu, at no cost. Seniors will not be asked to pay more than $35 a month for insulin, and they will not be asked to spend more than $2,000 annually on out-of-pocket costs for prescription drugs. For the first time ever, Medicare is also now able to negotiate directly with drug manufacturers, not unlike, I'm a last Vietnam veteran serving in the United States Senate, but I have a great interest in veterans issues, but the Veterans Administration has had this authority already for a long time. And then we just want the Department of Health and Human Services to have it as well. These negotiated lower prices mean that Medicare saves money and that our seniors will pay less for their medications. In Delaware, where I come from, we call that a win-win situation. The Inflation Reduction Act is now projected to save residents of Delaware some $28 million on prescription drugs next year in 2025. Let me just say it again, $28 million. For us, that's a lot of money. Over 63,400 Delaware residents are already seeing decreased costs for their prescription drugs. That is 63,400 people who will not be forced to choose between how to pay for the medications and putting food on the table, and 63,400 Delawarean seniors who will no longer need to make daily sacrifices to be able to pay for their prescription drugs. Moreover, 6,100 Delaware Medicare beneficiaries who require insulin medications are not paying a cent more than $35 a month for their life-sustaining drugs today. These are real savings that our seniors in Delaware and other places are seeing today, not next week, not next month, today. These are real savings, and we're grateful for them. Like many states, Delaware has a rising aging population, and with that comes a growing need for affordable health care for our Medicare beneficiaries. We have made great advances in that space, but we're not done yet, not just yet. Question for Dr. Conte. Is it Conte? Conte? Conte, okay. Would you please share with us some examples of the kinds of impacts that the repeal or rolling back of the Inflation Reduction Act would have on many of our nation's seniors?
Thank you so much for the question. There are several million seniors who have already benefited from out-of-pocket caps on drugs, such as insulin and also adult vaccines. In addition, there are 9 million seniors that will directly benefit from price negotiation, not price caps, on needed prescription drugs that they use every single day to keep well and deal with their diabetes and heart disease. In addition, my research suggests that another 5 million seniors will benefit from the next round of negotiation, and those seniors have cancer and suffer from other immunological disorders. Repealing would directly take money out of their pockets and likely reduce their adherence to treatment.
Yeah. Ms. Aiken, I'm going to ask you to answer for the record the same question. Before right here live and in person, I'm going to ask you, I understand you're a retired nurse. Thanks for all you've done with your life, continue to do with your life. In your testimony, you noted that you spent years of your life counseling patients on the importance of taking the medications. During your years as a nurse, what was your experience like that with patients who were struggling to afford their medications? What type of sacrifices did your patients have to make in order to afford drugs?
Thank you.
Please.
While I was working, we would have patients come into the unit, and we'd have to run through their med list and ask them when they last took their meds. And you frequently would hear someone say, oh, I haven't taken that for 2 weeks. Well, you know, you need it to maintain your health, and I just can't afford it. And then we would have to counsel them to go back to their doctor to see, you know, if there was something else that could be done or whatever. You wouldn't, you know, they wouldn't necessarily give you a answer other than that. I know in my own case, you know, if we had a month where our financial obligations were a little more than other months, I might skip a dose of my Enbrel to delay paying that outlay of several $100s so I could take care of the other bills.
All right, thank you. My time has expired, Mr. Chairman. Thanks so much for holding this hearing and for giving me an opportunity. I'm going to ask more questions for the record, but we appreciate very much what you do with your lives and very much for making sure that we do a better job in our lives. So take our responsibilities. Thanks so much.